A lot of people will try to address problems without really understanding them first. And so I used to think of it as kind of like a sphere. And a lot of the solutions that are proposed are kind of like on the edge of the atmosphere where they may sound good, but there's a lot of air underneath them that they can be easily undercut. And so what organizations like the Center for Public Policy, Americans for Prosperity, where Kate is, and where I am now at Empower Mississippi, we try to get to the depth of the problem, to understand exactly what's going on, what's causing the problems, to explore solutions that have worked in other places, or to come up with new solutions that need to be tried here that may address maybe some unique policies, some unique issues in Mississippi. And that's what it takes, is having people who are willing to spend the time delving into the details, getting into the weeds, and that takes a different type of person than just a politician who just speaks out in the atmosphere. Maybe they're a space cadet or something, that they're just out there in space and have only talking points. And so really in the movement and we call it a movement because we're trying to move people's thinking and minds to think right, it does take getting into the weeds. However, if you're not a person who likes to get in the weeds, that's fine too. Because we also need people who are willing to acknowledge and take that information and then speak about it to friends, to family members, or to teach, or to be very public. I mean, Douglas has not only a national audience, but an international audience. And so he's able to speak these principles and these truths to many people. And that's a role that some of you in here would not be comfortable with. But you would be comfortable with delving into the weeds so that he knows that he has the right information to then to speak. So whatever your personality, whatever your bent is, there is a place for you and you can make a difference. It may be that you are not acknowledged for it. And I hope that you are fine with that, because I remember a number of years ago there was a bill that we worked on when I was here at the Center for Public Policy that had to do with African hair braiders, because they were regulated as if they were if they did everything that a cosmetologist does. But African hair braiders don't use the same chemicals. They don't use a lot of they don't do a lot of the other procedures that a cosmetologist does. And so that was the government saying, you can't practice this that you're wanting to do without going to school for, I think it's 3 years is what it amounts to. Pay the cost, travel to wherever it is, to be able to learn zero about what it is you want to do, because there's nothing in cosmetology school that taught them how to do what they want to do. And so we worked on that and got them freed from that. And now there are more than 5,000 African hair braiders in Mississippi that were probably doing that in their home and doing it just with friends, or really doing it illegally because they weren't supposed to do it without a license. And now they don't have to have a license. And not only are there 5,000 of those now, but there are hair braiding academies that have popped up. And I remember the first one that I saw driving down Ridgewood Road here in Jackson, and I saw a hair braider school, and I thought, they will never know that I had anything to do with that. And that was great. I mean, I still, even now, as I'm describing it, I still get a chill, because what that was doing was providing opportunity where they had been restricted simply by getting government out of the way, not by providing any subsidies or any other incentives, but just by unleashing that entrepreneurial spirit. You now have people who are in business for themselves, they're providing for their families, they're teaching others how to do the same. And that's what we look for. Whatever the problem is, the solution is not to have the government fix it. There's a publication that we had here a number of years ago called Governing by Principle, and one of the principles is just because a problem exists doesn't mean government should try to fix it. Because that now, especially with the mindset that the professor talked about earlier, is we have this mindset that somebody else is going to fix our problems. And there is no limit to money because we can just print more. And all these ideas that the government can solve our problems, and like it's our savior, our source of hope and help in times of trouble. I mean, that's our first place we look. Instead of saying, what can I do? What can my community do? What can my church do? Before even thinking about what can the government do. So, whatever problems we're about to talk about, the solution is not to look to government unless it's to do like we did with the air breakers and get government out of the way so they can do what God created them to do and created for them to do. So I'm going to show you some graphs here. I'm going to go through them kind of fast because, and they're dated somewhat. But the reason that I'm going to show you these is just to give you kind of a broad overview of all the issues there are in our state and where we are. Some of these will compare us to other states. Some of them will just look historically where we've come over the years. And this was created several years ago and needs to be updated. But regardless of whether it's updated or not, I want to give you a historical view because on most of these, this will look back to the 1960s. This actually goes back to 1950. But most of them will go back to the 60s or the 70s so that you can see over time where we've come. And one of the reasons that we did this at the time was when there was one of these, I don't know if it's on this set, but there was a graph where if you just looked at it like news media will look at it, then it would have a point here and a point here just for 1 year. And you would think, oh, that's great. But then if you backed out 5 years, you would see that it was just a little uptick after it had dropped. I'm not talking about this graph. I'm just using this, pointing to a graph as an example. My point is, if you look at it for 1 year, you see a very limited view. If you look at it for 5 years, you still see a very limited view. So that when I pulled it back to the whole thing, what had happened is, I think it was on crime, it had skyrocketed from the 50s or 60s to the 80s. And in the 80s, when Ronald Reagan was president, crime came down, and then in the 90s it spiked. And so that one little thing at the end was just this much of a picture that looked much different if you look at it over the whole history, but over an extended period of time. It's important to have that perspective so that you don't take action or don't propose action that will fix a short-term problem with a long-term solution that is going to end up being worse than the problem, which the professor described very well earlier about what happens when you take the easy route, take something that sounds good, but over time actually is more harmful. It's just hard to get people to think long-term, so that's the importance of this. All right, so this is per capita income. And don't worry about the years, don't worry about the numbers. I'm just trying to give you a sense of where we've gone over time. And this is all inflation adjusted. So this is how much better we're doing in Mississippi. And if this did continue, and just in the last couple of years, we've now had a substantial increase in per capita income in Mississippi. One issue for Mississippi is that most other states have actually increased more than we have. So we're doing better. This is always important when you're hearing politicians talk too. We're doing better. We're not doing as well as we could, and as well as others do. That's a lot of lines. The labor force participation rate is very important to understand, especially when most of what you hear is about unemployment rate. How many of you have heard of the unemployment rate? All that.
Could we just go back to that previous graph and just make sure everyone understands what it shows?
Yes.
Does everyone understand that left-hand graph?
Yeah. This is per capita income. This is median family income. But we can just focus on this. This is the most common economic, at least when it comes to the income, this is the most commonly used statistic, is per capita income. And so per capita just means they take all the income that comes into Mississippi and divide that by the population. So that's the per capita part. All right, the unemployment rate measures the percentage of people who actually have a job compared to the total number of people who have a job and are looking for a job. That's it. So people, and we have the lowest unemployment rate in our history. If you follow the campaign this year, our governor continuously talked about the low unemployment rate. And that's good. That means people who are looking for jobs are getting them. What that does not include is all the people who are of working age who are not working or looking for work. That the labor force participation rate is the people who are working or looking for work compared to the whole number of people who are of work age. There's some exceptions, but that's basically it. So what that means is, with Mississippi, which is the red line, has the lowest labor force participation rate in the country. What that means is we have the highest percentage of working age people who are neither working nor even trying to find a job. Does that make sense? So we have the few, percentage-wise, we have the fewest people working in the country. And I'm going to run through these as you have questions, because there are a lot of these, and I want to be sure we get through them and have time for questions. So jot down any of these that you have questions about. We can come back to them, because there may be something later that you have a more pressing question than whatever you have right now. By the way, on this one, these other lines, the blue line is the country as a whole, the green line, and you'll see this on some of these graphs as we go ahead, as we move ahead, are other, basically it's other southeastern states. All right, transfer payments are what is, that's the label given to money that the government takes from people and gives to other people. So the government transfers, if you are paying taxes, they're taking your money and transferring that to somebody who is not paying taxes or who has other qualifications that allow them to get money. And Mississippi is consistently, this was 29 years ago, but it would still be the same, essentially the same now. We always vie with New Mexico to be the state that gets more of the money that comes into Mississippi in transfer payments. It's us and West Virginia, sometimes Arkansas and Alabama. So anyway, the red states on this graph, not Republican states, the red states on this graph are the ones that have the highest federal transfer receipts, federal transfer payments as a percentage of the income that I showed you earlier. So we are a welfare state. We have so many people who are dependent on the federal or state government that it's really not sustainable. We also, as a state, and I think there's one that shows this later, the state government is dependent on the federal government also for a significant, almost half of our state budget comes from the federal government. And who pays, where does the federal government's money come from?
Everyone.
It comes from taxpayers. Yeah. So we send money to Washington and the bureaucrats that take a bunch of it off and send it back to us. So and Mississippi generally gets more from the federal government as a state. I'm not talking about personal income. Generally gets more money. It's really kind of the same. It would be the same colors on the map if we had a picture of the state government getting money from the federal government, as this is for personal. So we're very heavily dependent, which exacerbates the problems that you heard about earlier with where we are and where the federal government is. All right, violent crime, again, got better in the 80s when Ronald Reagan was president. It spiked in the 90s, and then it came down after that. Now this one, especially in the last 3 years, has spiked again. Mississippi is still lower than all the other southeastern states in overall violent crime. However, our homicide rate is much higher than all other southeastern states and higher than the national average. A large part of that is due to Jackson. There are the numbers that this comes from is from the FBI that collects crime data from all over the country. There are other numbers that would show this is higher than the FBI numbers, but to be consistent, we just looked at it over that time. And it is a problem throughout the state. That's just in Jackson, it's especially a huge issue. This is the percentage of births to unmarried mothers. So, and this actually goes all the way back to 1930. You can see up until the 60s, it was relatively stable. The red again is Mississippi, blue is national, and green is the other southeastern state. So for probably 20 years now, more than half of the babies born in Mississippi are born to an unmarried mother. Yeah, and sometimes the term is out of wedlock birth. So they're born to an unmarried mother. This started to head up when our major welfare programs took. The Great Society, the War on Poverty, that era of the 60s was when programs were put in place that were designed to help, originally designed to help basically unwed mothers. But it's not because they never got married, it was because their husband had died, especially in the service. So to have where, I'll cover that a little bit later. Anyway, so out of wedlock births, Mississippi, more than half, for a long time, more than a half had wedlock. And this relates to that. The number of single parent families has gone up. There are 3 ways you get a single parent family. Either one parent dies, or there's a divorce, or they're never married to begin with. Children whose who are in a single parent family because their one parent died generally do just as well, statistically, just as well in education, drug use, crime overall, income. They do just as well as kids that grew up with both parents. Kids of divorce do just as poorly as kids whose parents never married. So, and part of that is because if a parent dies, then it's not that that parent chose not to be there. So there's all kinds of psychological stuff that goes into that. And generally speaking, in the home, that parent is still spoken of well, and so there's just a whole different dynamic. Good. Similarly, this is children who grow up in a two-parent and a married couple home, and these are children who grew up in a single-parent home. Now, a lot of times, out-of-wedlock births and teenage births are kind of used interchangeably in conversation. That really is not even anywhere close to accurate anymore, because this is for 15 and 19-year-olds that and this is just in Mississippi. So the middle line in this case is all races. The top line is black, bottom is white, and you can see that the teenage pregnancy rate has been plummeting for lots of years. Most people have no concept. And so what that means, if you think back to the single parent families, is that it's not because they're teenagers having babies, it's because they're adults who are choosing to have babies out of wedlock. This is a little different topic, although it is related. And this is the health determinants. Basically, this is we in Arkansas and Louisiana have the worst health outcomes. And the lighter shade of red is just next to us. But we consistently have bad health outcomes. A lot of this is still related to, really it's the welfare mentality of thinking, other people owe it to me to take care of me, and I don't have to take care of myself, including my health. I get along that way. This shows you basically in the state the worst health outcomes are generally in the Delta, along the river, and in these 4 counties over here in central Mississippi. Sometimes you'll hear that if we just took the Delta out, then Mississippi would be doing well. There is a little bit of truth to that. It is that we would be doing better, but it still wouldn't get us out of the bottom rank on a lot of things. Part of that is because the population has declined so much in this area that even though these health rates are worse here, there are a lot fewer people. All right, let's switch to education. Again, all the numbers on this are adjusted for inflation, so it's not like you could say, well, yeah, you've spent that much now and that much now, but prices have gone up. Well, no, this is adjusted for inflation, and this still only goes through 2015, but the pattern would be the same again with all of these. The pattern is the same. So the blue line is expenditures per student. So taking all the money that's spent in public schools and dividing that by the number of students. The bottom line is teacher salaries per student. So we often hear that we don't pay teachers enough, that we need to put more money into education. So we have put more money into education, but there's a growing gap that continues to grow between what we're spending overall and how much of that is actually going to teachers. So there's a whole lot more spending on non-classroom expenditures. And this is what we get for it. The blue line is ACT scores, and again, if we carried it out to current year, it would look exactly the same. It's just a flat line for kind of the exit exam for school, for public schools at least. And so all that much more spending, and we're getting the same result, basically. Now, you probably heard about the Mississippi Miracle. This kind of, the red line is the NAEP scores, NAEP. It's nicknamed the Nation's Report Card. It's considered, it's done every 2 years with a sample of students. And it's done the same in every state. So it's considered the best comparison measure from state to state. And so this only goes through 2016, but if it continued, if we had continued out here, this is the 4th grade reading score that actually has gone up, and we've improved in 4th grade reading and 4th grade math more than any other state, I think, in reading, and close to that on math. So that's really just occurred in the last 10 years, which is basically since in 2013, the legislature passed something that Center of Public Policy led the fight on, what's called the 3rd grade reading gate, where, and I assume some of y'all have experienced that either yourself or in your family, where you're not allowed to go to 4th grade unless you are reading at 3rd grade level. So that actually is required at schools to up their game, and they seem to have met that to the 4th grade. 8th grade, they still have not. They're better than we were. We're better. Those schools are better than they were on that measure, but not by much. And so we've got to take what has been used to get us to the 4th grade scores and put some different measures in later grades. What gets measured gets done, and so we do need that. It's a national test that's done not by every student and only every couple of years. What we do in our state, with our state scores, which we don't have up here, is we have a state test that's given every year, and all schools teach to that test, except the home schools. They teach, or the private schools. They teach to the test, and there's so much testing that goes on that it really defeats the purpose, and you don't get as wide of an education because they're just focusing on the things that will be tested. So there's a balance there. Things do need to be measured, but there's a balance so that you're not doing things, providing bad incentives to schools to focus on one thing to the detriment of others. So here's welfare spending. So originally, the main welfare program was called Aid to Dependent Children. As back in World War II, there were a lot of widows. A lot of men died in World War II and left a wife and children. And so originally, that was the idea of welfare. And so everybody said, oh yeah, we need to support them. So you had this nucleus of people, and everybody said, yeah, we need to support them. But just beyond the edge of that circle were people who made just a little bit more money. So wouldn't it only be fair to include them? Yeah, we need to include them. So expand the circle. Well, now there's more people who are just beyond that circle, who make just a little bit more money. Wouldn't it just be fair to include them? And so on, and so on, and so on. So now you have a huge circle with people here who never would have thought, well, I need the government to take care of me. Back when it was this, back when it was at its beginning. And you have people here who that just wouldn't have crossed their mind. But now that the circle has expanded, now they expect it. And now if you try to cut it or restrict it, then you're taking away something. Instead of giving them something but less because we can't afford, it's that you're taking something away, which is a huge political issue, political problem that even a lot of conservatives have a hard time accepting and responding well to. So this is welfare spending in Mississippi. What have we gotten for that? Because almost all of that went to single mother-led families. So this is the poverty rate. This is the total poverty rate over time. This starts in 1960, and it came down and has been level pretty much since then. But this is the poverty rate that all that money that we spent was supposed to help single mothers, but yet their poverty rate, even then, even in 2015, was close to 50%. So again, sounded good, sounded compassionate, didn't solve the problem. That is a refrain that you will see with pretty much any government program there is. Medicaid, we've heard a whole lot of talk about that. It started in the 70s actually. Didn't start back in the 60s, at least in Mississippi, it started in the 70s. And I used to have a document here, I don't know if it's still here, that showed that when Medicaid was first approved by the legislature, there was a report to the legislature from a committee of the legislature that said, if this ever goes beyond $11 million in cost, then we'll see that it's going to cost too much and we need to shut it down. And that was in the 70s. That was 50 years ago, so obviously that would be more money now. But at this point, we're spending $7 billion on Medicaid in Mississippi, and about $1 billion of that comes directly from state taxpayers. The other $6 billion comes from our taxpayers and others around the country. And we have we have about a fourth of our population now. It's come down a little bit, but about a fourth of our population in Mississippi is on Medicaid. And then the last one I'll show you is this. This is state and local employees. The blue is local, the red is state. Mississippi has a higher percentage than any other state of people who work for the government. Part of that is to administer the programs that all these other things that I showed you are funding. I will say this, but we could do away with all of the welfare money that I showed you ago. We could do away with all of that and write a check. I don't know what it would be now, but I think it was close to $30,000 to every family under poverty and be done with it. That's how much we're spending. I think it's more than that now. But we're spending so much on welfare programs that if we just took all of that and wrote a check to people who live in families who live in poverty, then we could write them a check. It's probably closer to $40,000 or $50,000 now. And fire all the bureaucrats and make it much simpler. But then that would then grow just like the other did. Because now, well, if you're sending that person a check, I make just a little bit more, so you should send me a check for that amount too. So again, it's very dangerous to go down that path. So I've thrown a lot of numbers at you. And I did that so that you would kind of get an idea of all the different categories there are. And then, so I'll ask for your questions, but I'll also ask for your answers. What do y'all see as the main problems facing Mississippi? Not a dissertation, just a category.
Well done.
Thank you. Either questions or comments, yes.
I think like welfare and government assistance is our main topic.
I would agree with her, and I would like to know what, well, I guess you said another speaker's gonna answer kind of how to fix these problems, but as just the group of people that are here, young people wanting to know how to change Mississippi politics, is there anything that we can do? What would be the next step for new generations to be able to make Mississippi not so, where they're not, I can't remember the exact percentage you gave, but where that many people do not rely on state aid? What would be the first step to?
Well, actually, this class is part of that, is learning what the actual facts are is a huge step in that.
So just more people being educated or what's going on?
That will help, that's the first step. But people can be, cigarettes, people know it's gonna kill them, but they still do it anyway. So just being educated is not enough, you have to act on what you learn. And so part of it is really tough for your generation is because you have grown up with the welfare mentality. And it's not just poor people who have that. It is people who are of middle and upper income who still look to the government to be their savior. And I remember meeting with a donor, they're both dead now, but it's a married couple. And they had a lot of money, but when I was meeting with them one time, the husband said, yeah, we've been working real hard on trying to get her on Medicare. And there was more to it than that he said. And I thought, thank you. I mean, you're welcome, because I'm now the one that's paying for your health care. And I mean, even think of it this way, Bill Gates, who is of the Medicare age, Elon Musk, Jeff Bezos, when they get to be 65, we're going to be paying for their health care. Because if you're 65 or older, you're not allowed to pay your own way. If you go to a doctor who treats you and you're that age, that can only be done legally either through Medicare or if the doctor decides not to charge you at all. So there's just this whole mentality across the whole spectrum. So that's the first part, is learning what the facts are, start thinking long term, like you heard earlier, that it's not just the short term that we need to be dealing with. What is the long term effect? That's part of the argument on Medicaid expansion. What is the long term effect if we add another 300,000 people in Mississippi to the welfare rolls? We have a third of the state who is on Medicaid. Sounds so harsh to say because it's interpreted as, well, you don't think that they should get health care. Well, no, it's just one. That's a whole different issue on whether Medicaid actually helps on health outcomes. But you now have yet more people who are thinking, I can only exist if I depend on the government. So that mindset among your friends is huge. And then Kate will talk to you about things that can be done with the government, that the government is either involved in or is the cause of, and maybe a few potential solutions of getting the government out of it.
Sorry. So one of my professors that has a very different mindset than me, talks a lot about the budget. I don't know what you specifically called it, but all the money that Mississippi gets given because we're in need the most, all the taxpayer dollars from all the other states. And his argument is that our governor is, and I quote, not my opinions, is foolish to not want to take that money because it's got to go to someone. How do you break that mindset of someone? Okay, so Mississippi will just mooch off of everyone else in the states for the rest of eternity. How do you break someone's mindset of that? Of it's got to go somewhere. Bring it to poor Mississippi.
That's very difficult. And I have friends, again, who are doing very well, and they say, well, it's not like Mississippi is going to make that much of a dent if we don't take it. I mean, one of the things is to say it's all borrowed money at this point. It's all borrowed money. It's not, and you could take not just the income from the wealthy, but you could take all of their wealth and it still wouldn't make a dent. Plus, then they, in our national debt, and then they wouldn't have money to be able to invest and create jobs. So especially for a professor, it's not real likely that you're going to change their mind. But what you can do is ask questions. Say, okay, where does that money come from and how are we going to pay that back? Somebody's going to pay for it. So you're for making our children and grandchildren pay even more. Then, how is that going to work out for them? How is that compassionate toward them? And at least hope to get some people in your class to think, well, maybe not everything this professor is telling me is something I should just take as absolute true.
See, that's why I want to learn how to better respond or ask questions, because while I am more educated than my other 40 classmates, they just take by his word and then roll with that. And then they spread it to more people. But I would never be disrespectful and want to, just.
I think one way of doing it would be to ask the professor, how big would Medicaid, should everyone be on Medicaid? Because we do have countries where everyone is on their equivalent of Medicaid. In the United Kingdom, they have a socialist system where everyone, the whole country is on Medicaid. It's called the National Health Service. And you can measure the outcomes. You're better off having a serious disease in Mississippi and being poor than being a rich person on the British version of Medicaid. Cancer survival rates are better in Mississippi for poor people than for rich people in the UK. So I think the question to ask the professor is, does he think Medicaid should be for everyone? And is there a country that has Medicaid for everyone that has a better healthcare system? And I think that's really the nub of it. If Medicaid's so good, why is it that patients on Medicaid have worse health outcomes in Mississippi? There was a very interesting report put out showing that we needed to expand postpartum care. And it said we need to expand postpartum care because people receiving postpartum care on Medicaid have had worse outcomes. Well, surely that's an argument against expansion. So, I think challenging advocates for Medicaid expansion, do they want to put everyone on Medicaid? And are they happy with countries that have Medicaid-type universal socialized systems?
Yeah, and they're probably going to, if you ask them that, they probably would say, yeah, we need a single-payer system, which is exactly what is in the UK, it's in Canada. Several years ago, I was in Canada for a few days, and the headlines every day that week, I don't know if there was some special emphasis that week, or if this had just come out, or if this is every day of the year, but people who were, had become addicted to opioids because they were having to wait months for knee surgery. So not heart surgery or brain surgery, which obviously would have even worse effects. But that's happens where they really.
There are 60 million people in the UK, and yet the number of people today waiting to get treatment from the socialised system is 7 million. In other words, more than 1 in 10 people in the country on average is on a waiting list for healthcare treatment. because it's free and so you can't get it.
And there was an article in the past week or so in the Magnolia Tribune of somebody who, a mother, I think, whose child was not able to get care because because there were no doctors around that took Medicaid. So what happens if you then add 300,000 more people onto the rolls? And that's that many more people who are trying to get health care from physicians in Mississippi. And we have the lowest physician to population ratio. But one of the things we've advocated for is having more authority for nurse practitioners, especially in the areas where there is nobody else. The doctors oppose that, but that's an issue of Medicaid. So you're doing this by expanding, you're doing a disservice to the existing Medicaid population. So again, do we include everybody? And what's the consequence of that? And I didn't know that about the comparing Mississippi, low-income Mississippi to wealthy. Okay, that's fascinating. Okay, I'm going to be around Kate, who did get the memo on the shirt for the afternoon sessions. We'll follow up and then so I'll be around.
Forrest, that was wonderful. Thank you so much.
Thank you.